I was born in Bangladesh, and I came to England in 1966 as a boy, 11-year-old boy. And I came because my uncle offered me. He brought me here. And at that time, obviously, only young men from Bangladesh were here. And they came to work in the factories as laborers. And people started to bring their sons and nephews and to this country. But at that point, people didn't bring their families. There was because they didn't think the point of bringing the families because they were a burden. The family bringing here, you have to look after them, you have to house them, feed them, keep them in Bangladesh. Being only the ones who are going to be economically beneficial to the family. So that's why they brought in young boys, so that, eventually they will be working and earning for the family. And the understanding at those times was people to work for 6 months, 1 year, couple of years, and then go back, stay there for another 6 months, and then come back and earn more and then go back. I don't think at that point there was any intention of people staying here permanent. That idea came along later on. And when I first came here, obviously it was a completely different way of life here. Everything's like different from Bangladesh, and being, not having your mom and your siblings and your, all your friends back at home. It was really strange, and it's particularly, when you are a young boy amongst men, you are sort of, that's even more, But I was luckily, I did have relatives, my uncles and relatives, and they all looked after me. They cared for me, and in their own way, came and lived in. It's a small town called Mosley in Greater Manchester, small industrial town. And I went to secondary school there, mostly Hollins. And I studied, I was there for 5 years, and then I went to college. And afterwards, after I've come, about 1 year later, people started to bring in, their children as well. And I think it was started about 1970 onward. People started to bring in their families as well. So that, that's the sort of history of how, families started to come to.
So why then, do you think?
Because I think there was a change in immigration rules. People could bring in their families, yeah. And I think at that point, they couldn't bring their boys, so they had to bring their wives and children, everybody, the whole family into this country. And I've known at that point, some people actually brought their family in, kept their sons, and sent the wives back again home. There were some people like that as well. But then later on, they brought their wives and daughters back as well. Yeah. What do you want to know? Although, when I went to school, I did have English friends, but once the families from Bangladesh started coming in, it was a different type of environment. We were playing in the park as the way we played back in Bangladesh, in the afternoon in the park, and all the families there, all the children there. It was like back in the village. Everybody sort of loved each other, cared for each other, looked after each other, and and in those years, I'm talking about from 1972 till 80s, that kind of time. Um, it was that kind of environment. And it's a small town, but there was about 40 to 45 families there, and everybody knew each other, even though they came from different parts of Sylhet. They were all from Sylhet, but they came from different parts of Sylhet. But the way they uh, um, live their life is as if we are all from the same village, because we were going to each other's house, invited each other, and all the children playing in the park, and we sort of respected the elders like the way we did back in Bangladesh, and the elders sort of love, looked after the kids as well. So it was a completely, it was a nice environment actually. When I first went to school, I was the second Asian boy to go to that school. Yeah, but luckily the teachers were really lovely teachers, and they sort of gave me extra sort of coaching to get learn English, and also what I could notice is that in my classroom, I was the only Asian boy. And the way they treated me, the teacher treated me as if someone who needed care and attention. And because of that, the other children sort of been nice to me. You see what I mean? Only people that was not nice, sometimes I found, is the ones in the street that I didn't know. Okay? So all the kids I knew at school have been very nice to me. There was no issue with racism or discrimination or anything like that. But back in the street, sometimes I would come across somebody, a young chap calling names. I have come across that.
What kind of names are we talking about?
Paki, and when you challenge them, they say, well, what have I done to you to call me that? And then they started being aggressive. So I was ignoring them. I had to ignore them because otherwise you have to end up in a fight. And so yes, I did face that kind of situation. After I finished my studies, I worked in a community project in Rochdale for a year. And after that, I moved to London because there was an opportunity, there was a job going in at that time. The GLC was in existence on those days. And they created some new posts working with the community, especially around racism. At that point in London, especially in East London, there was a lot of issues going around racism and racial attacks and so on. So they needed people from the community to sort of support them and help them. I was sort of recruited one of those posts, and the post I was recruited to is the bilingual receptionist in one of the in one of the offices in East India Dock Road, DLC office. I came to London, and I was there for about a year. And then GLC got disbanded, and all the stocks and staff and everything, housing, everything sort of were transferred to the local authorities. So for about 6 months, I became a local harmless council worker. Then after 6 months, I moved to a housing association, or New Lawn Housing Trust. I was at the, yes, as a housing officer. And while I was with the GLC, I actually got promoted. I was doing well, in my job. So I got promoted to a state officer, and then I moved to New Lawn as housing officer. and that was in 84, around 84. I think 85 or something, around 85. And I was with Newlon for about 18 years, working again. Started off housing officer, then I became area manager, team leader. I just promoted. And in 2004, I moved to Bangla Housing Association, where I'm working now, Bangla Housing Association. I've been with the Bangla Housing Association now for over 17 years now. Okay, the personal life is that I went back to Bangladesh in 1980. Got married, brought my wife in that year, in 1980. And then I had two children, young children, when I moved to London. Yeah. And after I moved to London, I had another child. So I've got three children. Obviously, they're all now grown up. They're all now, they've got their own professional jobs and and I'm granddad. I've got now 7 grandchildren. Our predecessors, I saw the people working in factories and how hard they worked, and the way they were treated. I didn't want to be treated like that. I always wanted that. I wanted to be like the white community, the white children, and I want to be able to work in a professional job. And I didn't want to work in the weekends and in the evenings and so on. I wanted a 9-to-5 job, and same thing I wanted for my children as well. I wanted my children to do even better than me, and I looked after them, and I made sure they went to the schools and they got the right education and the right support, parental support and support from school. And I'm pleased to say that my children has really done well in the education system. In this country, there is a lot of opportunities, and if you've got the courage, and if you really want to do well in this plan, there's nothing stopping you. Although we say that there is a lot of discrimination, there is a lot of racism and all that, but within that, what my experience is that if you are willing to work hard, then yes, there is a path. There is people out there will help you, but it has to come from yourself. Nothing is going to be given on the plate. You really have to go for it. That's what I always, even as a child, I always thought about that. And that thinking is still there. And this is something I always say to, in Bangla Housing Association, we take children, school children, for their placements, the 2 weeks work experience placements. And I really encourage these kids, them from the BME backgrounds, Asian children. And one of the things I will keep saying to them, you really have to work hard, the white, but if you are prepared to do that, then there is nothing stopping you. But, this country, what I've realized is that if you want to have an easy life, you can't have an easy life. Yeah. And that life is going to be benefits and, at home doing nothing. You can have that. But if you want to have a professional life, and you want to really get on with it, achieve things, then again, it's there as well for you. If you have it, you can go for it. You got to really work hard for it.
What was life like just before the lockdown?
COVID was like, it could go everywhere, anywhere, go to the office or go to friends, relatives' houses and visit them and so on. So, it was like fantastic life, But then with COVID, with the lockdown, everything changed. As if suddenly you found yourself We at Bangla Housing Association, immediately what we done is we felt that we have to carry on with providing the service to our residents. And we, we had to be working from home because our office was closed. All the staff were working from home, but we had to do it. We had to sort of make arrangements to work from home and continue with our services. In such a short period of time, we had to sort of adjust ourselves that kind of setting. And with the technology, it really helped. Obviously, we've got laptops which are VPN connected to our server in the office. We've got mobiles, and with the Zoom meetings and Microsoft team meetings and things like that, we actually kept very much in contact with each other as a team, the external and outside world, and we also kept in touch with our residents as well, with the phone calls, one-to-one phone calls, and with asking people to make sure they go to our website and look at the information, and we sent out informations, how they need to be able to contact us in the lockdown, and also importantly is stay safe and sort of adhere to the government's guidelines in terms of your hand regularly and having a mask if when you're going out and keeping your distance. And at Bangla, we did something special, in my opinion. What we did is after the first, back in April, after the first lockdown, it came to our attention that the Bangladeshi community, BME communities, and particularly the Bangladeshi community, had been disproportionately adversely affected by COVID. There was a report that came out in Guardian, a newspaper, and also in the Newsnight, the report, highlighting the fact that Bangladeshi community has been impacted in such a way that the death rate, the infection rate, hospitalization was 3 to 4 times higher in the Bangladeshi community. When I saw that report, it really made me thinking, now we need to do something about that. I can't just sit and wait and feel sorry about it. We need to do something about it. So what I did, Bangla is a member of a BME London landlords group. It's a 14 BME housing associations. We have a arrangement where we work in partnership, exchange ideas, best practice, and so on. So I took it to that meeting, and I said to my colleagues, 14 people in one room, in a Zoom meeting, I said, here is the report. I actually sent it to them and got them to see the report. Here is the report. Now, I want to do something about it. Are you going to help me? And they said, what are you going to do about it? I said, we need to get the message across to our community. Firstly, is how to stay safe. Because it looks like the message is not getting there into the community. Lots of people are being impacted because of the fact they don't know what to do. They don't understand the seriousness of the disease and the importance of making sure that you wash your hand or your face and keeping a distance, not to visit your relatives, because life is no longer same as before. So you really have to be very carefully. And there was at the same time, there was a lot of disinformation circulating in the community at the same time. Because for some reason, some people were thinking it's not going to affect them. It's not, it's somebody else's problem. It's something that you hear people are like, it's not going to come to me. I'm okay. I'm that kind of attitude. So we needed to do something to sort of counter that kind of. So I was explaining all that to my colleagues, and they said, okay, look, why don't you apply for a grant to set up a project? Somebody suggested lottery, national lottery. And then another person said, okay, I know somebody who can help you with the writing of the application. And that's it. So, they gave me, they said, we'll support you, help you, whatever way you want, go ahead and apply for this grant. So we applied for this grant, we got it, we received £50,000 to set up this project. And obviously I had to tell them, exactly what I'm going to do. And the sort of things I was saying, that we are going to employ advice workers in bilingual facility, Bengali speaking workers who would be contacting our residents and our clients and people that we know, direct contacts, one-to-one phone calls, and ask them how they are, do they realize what they have to do, and so on, and give them any kind of support if they need. Yeah? And secondly is to do a leaflet, a translated leaflet explaining the rules and what people have to do, and where to get help, and if someone has the disease, then what that. So we got that. On top of that, we did a video. We did a translated. I don't know if you saw. You will have seen this video. It came out in the beginning from the NHS, and it's the wash hands, cover your face, keep your distance. So what we did, we translated that video in Bengali. It's a voiceover. So it's the NHS video, but it's like a Bengali person speaking. Yeah, and it really was effective, actually. So we done that. We done another video. People who are familiar faces in our community, we got them about messages. So we done that video, and then obviously the leaflet and posters, and we sort of we started this the project. We started in October, because it took a couple of months to. And obviously at the same time, I had to make contact with lots of people who I knew in the community who were community leaders. And I asked for advice. Look, this is what I'm going to do. This is what we're doing. Can you help us? So if people couldn't help, they actually said, look, why don't you speak to that person? Yeah. They've got a more network, and they've got more ideas of how they can help. So that way, I managed to make contact with lots of different people. I made contact with a media person, Bangladeshi. He's the treasurer of the British Bangladeshi Press Club. And he was really very helpful. What he did is he did news items in newspapers, Bangladeshi newspapers. And then I had a young councillor, Taham's councillor. He's a young chap, and he's really got a lot of good contacts in the community. And I got him on board as well. Yeah. Is Abdullah. Do you know Abdullah?
Yes, I do.
Yeah. Abdullah is and then Masoom Saleh is the other person from the media. So I use them as my sort of advisors, and they help me to get to the community as well. But from my contacts in the community, and I sort of a lot of people as well. So we set up a network of community advisors and people. We call them our community champions. About people in Tower Hamlets and to help us, getting the message across. We made contact with lots of community groups in Hackney. We sent out by emails, by WhatsApp messages. We contacted all the schools in our hamlets, all the schools in Hackney, medical centers, hospitals, and gave them our leaflets, our posters, video for them to share with their, contacts. Yeah. So we just, the idea was, and this is what we said in our application to the National Lottery, that we want to get our message across to 10,000 Bangladeshi families or 40,000 people in the Bangladeshi community living in Hackney and Tower Hamlets. We want to focus in Hackney because this is where we are, and Tower Hamlets is where most of the Bangladeshi people live.
Well, that's where your target is.
Exactly. So we got, our target area was Hackney and Tower Hamlets. So where we worked, and at the same time we made contact with the mayors of Hackney, Tower Hamlets, the public health teams, NHS, and anyone else, who is working with the community. And we just wanted to engage with all these different agencies that, we are working together in order to help the community. And, our workers and my staff, we all attended training courses, attended lots of meetings with the voluntary center, and regularly attended the, this community champion meetings. I think we went to one of them, and I saw you there. So community champion meetings in Hackney and in Tower Hamlets, because I wanted everybody to knew about us, what we are doing, and I wanted everyone to support us, and in whatever way we could get the message across to the community. Yes.
I mean, from this experience, obviously a lot's been happening within a year,
Yes.
and we all had to learn things quickly, swiftly, and get the message out there. But from your personal experience, what were, let's say, the three most things that you actually learned from this mayhem, isn't it?
I'm a Muslim, and our belief is that if it is God's will that you have to die on such a day, then you will, no matter what you do. I believe in that. But I also believe that you have to look after yourself. You have to do what you have to do. If you are ill, take medication, go to person and all that. If you are ill, not to say that, no, that's it, I'm ill, I'm going to die. God's will. No, it's not like that. You are ill, seek medical advice and help. So I feel that some people who have died is because they didn't know how to save faith, because it came as a sort of surprise to everybody. People didn't know it, just suddenly there. Obviously, they realized later, as we progressed, that you really have to. Hygiene is a very important part of being safe, staying safe. The distance, distance, covering your face and washing your hand is very important. But initially, people didn't follow that, and that's why the disease was spread very quickly. And obviously, there are other underlying issues as well. These inequalities, structural inequalities that exist in society, and poverty is a very, multi-generational households, crowding, underlying health issues like diabetes, hypertension, and because that is prevalent in our community. The elders, and that has, I think, that has contributed to, the Bangladeshi community, more people sort of dying, hospitalized because of that underlying issues as well. So, and one thing I have learned, throughout this experience, that you cannot just sit down and take it. You really do something about it. So one of the things I've been saying to all my contacts that my work is not finished. Our work is not finished. Mm-hmm. It's started, in the sense that, okay, we are beginning to relax, and lockdown is being eased and everything, and people are saying that we have to live with it. Okay, fair enough. We have to live with it. But what about, we have to ask ourselves, right? Why is it that the BME community, the Black and ethnic minority, and the Bangladeshi Christian communities had been so adversely affected by this illness? What is it? We really have to think about it, and we have to do something about it. We have to do something about it. So, and it is up to the policymakers, the government, and the people who make the decisions, and who can do something about it. They are the people that we need to shout at and go to and find out. They need to come up with a program, with a long-term a program of how they're going to tackle these structural inequalities that exist in the society. We cannot just sit down and say, oh, hard luck, this happened. Those days are over. We really need to. And obviously, we are going to go into another project. Mm-hmm. And that project is, and it's called, we are going to call that, this project that I've been talking to you about, this is called Bangla COVID-19 Advice Project. We are still working on it, but there is another project we are going to go into, and it is the Bangla COVID Recovery Project. So, and the recovery project is going to tackle the issues that the impact of COVID, the legacy of COVID. Things like mental health, health and well-being, financial impact that families have had, and there's been a lot of bereavement, and support. People have lost jobs, so, and those jobs are no longer available. So what do they do now? Another thing, a lot of Asian communities, they work in the frontline jobs, frontline, low-paid frontline jobs. Maybe this is also something we need to, again, it's a longer-term project. Train people up, give them the training to go for different type of jobs, why not? And people, those who have lost their jobs, obviously, that kind of jobs may not be available anymore. So they need to retrain into different, or different jobs. Lost income, how they can get back to a reasonable income level. And the health issue is a very big one. Mm-hmm. People will be suffering from mental health, and how do we support them as well? People lost loved ones, and having been in the lockdown all these months, and there is a lot of people. There is a feeling of loss, and how do you support that, this type of people? So all these things we are going to be dealing with in our next project, 19 Recovery Project. And we've applied for another grant. We have applied to the National Lottery. We haven't heard anything yet from them. Hopefully we're successful. That's our next project. But that's a longer term project. It's a 2-year project.
Mm.
The BCAP, Bangla COVID-19 Advice Project, was for 6 months. But this new one we are thinking of doing is for 2 years. About 2 years.
And Bashir, what's the last thing you would like to say before we come to a close?
There is hope. We live in hope. Yeah. Also, we have to work, and we have to work together. We cannot work in isolation, and there is help out there, and we have to look for it. Find the help, and work with other organizations, work with other people, and share your experiences, because we'll all have our own experience of COVID. Everybody in this country, different impacts. Everybody, they will have experience. So everybody, I think, are much more willing to help each other, listen to each other, and be kind and generous to each other. And COVID. That's what I think. That's my feeling as well. So, and while that feeling is there, we need to make sure that we hold on to it. So we work together, because I always felt that we are all in this together. So yeah.
You sound like a politician now.
Exactly. Yeah. Everybody, And I'm pleased about the recognition that we got from Hackney Council.
Yeah. Well, Bashir, the only thing I can say is that I'm very grateful for you giving me the time to interview you.